My name's Christina McLean. I am the Head of Rehabilitation and also the AHP lead for the Golden Jubilee. So I manage the rehabilitation services across the hospital. We have physiotherapy, occupational therapy, speech and language therapy and dietetics within rehabilitation, and we provide services across both of the key divisions of Heart and Lung Division and NES. Recently we have implemented a new rehabilitation structure which has meant that we have essentially kind of split our workforce between the two divisions. The reason we've done that is to try and create a team, a multidisciplinary team within both divisions. So within NES we have occupational therapy and physiotherapy, and within Heart and Lung we have occupational therapy, physiotherapy, speech and language and dietetics, because those are the core AHP groups that work within those divisions. My main responsibilities are to make sure that we do have the appropriate workforce available to provide the services that our patients are accessing, and that we have an inspired and enabled workforce that feel that they can be agents for change themselves and that they can influence service improvement and development where they see that there's opportunities to improve things.
I am team lead for the AHP services in Heart and Lung, managing the 4 professions: physiotherapy, speech and language, occupational therapy and dietetics. So my job is to ensure that the team is working as a team, and we provide services for cardiac surgery, thoracic surgery, advanced heart failure, Scottish adult congenital, cardiology, and we've been doing some of the urgent cancer work, laryngectomies and esophagectomies. Prior to this I was the physiotherapy team lead, so again was my job to ensure that the physiotherapy services were adequate across the 5 specialities, and the way that we did that was we have a band 6 leading in thoracic surgery, cardiac surgery and advanced heart failure and cardiology, and I'm trying to establish that within this new role with the dietitians. They're a very small service, there's only 3, and they're broken down into someone for critical care, someone for thoracic and cardiac, and then ad hoc cover for the rest of the services. They've been impacted a bit with the cancers, the urgent cancers that we've been taking from the territorial boards. Our occupational therapists, we only have 2 occupational therapists across the floor, a very new service in critical care and a service for the wards. That's an established service. And with our speech and language therapists, we have 1 speech and language therapist who's supported from Greater Glasgow and Clyde with a couple of sessions, and it's quite exciting because they have developed a new video fluoroscopy service that we didn't have before. And our speech and language therapist is about to be trained in FEES, which is a new diagnostic machine that will help elicit much quicker responses for swallowing difficulties.
I'm a physiotherapist, but within the team I am the team leader. So I organise the orthopaedic physio team on a day-to-day basis. My main responsibilities are the day-to-day organisation of the orthopaedic physiotherapy team. So making sure that we have physiotherapists in all the different clinical areas that we cover to make sure that the patients are seen by physiotherapists in order to help them reach their rehabilitation goals after surgery.
Day to day my job is quite varied. I carry a complex caseload of mainly orthopaedic patients, but I can also provide cover in cardiothoracic wards and seeing the patients admitted for osteosarcoma surgery. A typical day for me would be attending the ward handover in the morning, ensuring all clinical areas are appropriately staffed and caseloads are well managed. I would carry an orthopaedic caseload during the day, assessing patients' function after hip and knee replacement, promoting independence for discharge home. Throughout the day I would also provide leadership to the occupational therapy team.
For me, as an occupational therapist, we look at the things you do every day, from getting yourself washed and dressed, getting out of bed, but particularly in critical care that's a bit more difficult. So it's more kind of goal setting with the patients, looking at what they want to be able to do, what they were doing beforehand, and then kind of working with them towards those goals, be it kind of through upper limb rehab or cognitive assessments and things like that, to kind of get them back to hopefully what they were doing beforehand.
Dietitians have a protected title, and we can give people advice on nutrition and to promote their health through eating better. But also, especially within this hospital, it's providing artificial nutrition support for very sick individuals who might not be able to take food orally. So that could be patients on intensive care or on high dependency, and those patients often are fed through a feeding tube, or they might be fed intravenously.
So basically we look after staff members in here. We're a service available for anyone who's employed by the Golden Jubilee, and that kind of service extends to volunteers as well. So we provide musculoskeletal physiotherapy assistance for all of the staff members here. So anyone with sore backs, knees, hips, anything else which might be impacting on their work, we will prioritise. But we're fortunate enough that we can accept other things as well. So if someone has an issue which is affecting them outside of work, if it's stopping them doing what they're wanting to do in terms of their hobbies or their caring responsibilities, we provide advice and support for those guys as well.
I have a split role. I work firstly as an occupational health clinical specialist physiotherapist, and secondly, in my other half, I work as an advanced practice orthopaedic foot and ankle physiotherapist. My occupational health role is diarised, so Monday to Friday it's a sort of diaried slot, so I can very much block off occupational health day or orthopaedic clinic day or orthopaedic clinic return half day. So I'll have 2.5 days blocked off for occupational health and 2.5 days blocked off for orthopaedics. But it is a challenge because you do get phone calls for orthopaedics on an occupational health day and vice versa. It's a role that is not traditionally a physiotherapist's role, so I work down in the orthopaedic clinic with our 2 foot and ankle surgeons. It's not a physio job, it was originally termed a ESP job, an extended scope practitioner job. The framework of advanced practice is something that's always advancing. It's being recognised more as an advanced practice physio job. There's not that rehab element of physio in it, it's more using your kind of diagnostic skills and working in clinics, so it's less active and more consultation style job.
In terms of the impact of COVID, the biggest impact we felt was obviously the disruption to surgical services, and the fact that theatres couldn't continue as we had been, kind of pre-COVID.
Life changed in terms of day-to-day practice. We suddenly couldn't come anywhere near each other and masked up, and the footfall through the department had to change, and our organisation of who works where had to change.
Our services are critical services, so they didn't stop. Some of the elective cardiac surgery stopped. Our thoracic patients, 70% of them are cancers. So from a heart and lung service, we didn't stop surgeries. The difference for us was that we had an increased amount of physio staff and other HP staff whose services had stopped, like the orthopaedics. So what we did was we did some basic training with them, so they were able to come and help us with the more routine patients that we have in the heart and lung service.
I would say we are getting back to normal. Yep, our elective orthopaedic service is back up and running. The only thing we're not able to do at the moment is commence our face-to-face joint schools, but as I said, we've got the joint school videos on YouTube, so they are still accessible, the information still accessible to patients. We are still a little bit limited in our rehab gym in that we only bring one patient into the gym at a time, so we don't have patients crossing paths. So that's a little bit restrictive. What we are finding is that there are some other challenges across the hospital with theatres and theatre staff, which is impacting on the kind of predictability of activity, which has been a little bit challenging for staff, just in terms of knowing whether they're coming into a busy day or a not so busy day, and trying to maintain the correct workforce balance and making sure we've got the right number of staff on, and we don't have too many staff on days where potentially there's not much activity happening.
We've been doing some data collection with patients, and the questionnaires we've had back from them have been very positive so far, with people saying kind of positive, I'm being happy, I'm being very grateful for the service, things have been explained well to them from occupational therapy, so it's lovely to hear that the patients are happy with what they're receiving.
We are able to offer a good service to the patients. They are seen promptly and they are seen frequently whilst they are in hospital. We have the time to provide a kind of high quality patient-centred experience, and we do receive good feedback from them. I think definitely we have to have an eye on the future with regards to our service. We've obviously got the backlog of elective surgeries that have been paused or cancelled during the COVID-19 pandemic, and obviously with an eye on the hospital expansion as well as how our service is ready to meet that increased demand.
We have a very motivated, innovative team here within rehab across both of the divisions, so within elective orthopaedics and within cardiothoracic and within urgent cancer now. A large focus of our work in the coming year is really going to be on prehabilitation, because prehabilitation has been identified as key to part of the recovery of COVID. For patients coming in to hospital for any surgical procedure, we want to optimise them as much as possible before they come in for their surgery. Prehab was always a big driver for us anyway, because it's a kind of core component of any successful ERAS programme. One of the challenges we have as a national board is that because our patients come from across the country, how can we offer a kind of individualised prehab programme? We can't invite patients here for a weekly exercise class, you know, if they come from Edinburgh or, you know, the islands and things like that. But actually with that, COVID has brought us an opportunity to look at things digitally and remotely and really optimise some of those digital solutions to offer bespoke, individualised programmes to patients who maybe aren't within the local area. So I think prehabilitation is definitely going to be a big focus for us in the next year, and that'll be across services. We really do need to scope that out, because if we are going to increase the number of patients that are coming through our service, particularly within elective orthopaedics, the only way really that we can do that is to maintain a short length of stay after their surgery, and the best way to do that is to optimise the patients before their surgery. So it's about moving our resources upstream so that we're seeing the patients before their operation, getting them as prepared as possible, optimising them as best we can so that their recovery is expedited and we can get them home, because actually that is the best place for them to recover and have their rehab.
What I love about my role here at the Jubilee is that I still are able to see patients and see the impact that our service has on patients' outcomes after surgery. But I also love that I am developing a team that look after each other and have each other's well-being at the heart of what they do.
It's so rewarding, particularly when we have long-stay critical care patients. The work that goes into rehabilitating these patients is immense, and it's absolutely a teamwork from the medics to ourselves, the nursing staff. And then when you see somebody who's a really prolonged period in intensive care, has been really critically ill, and you see them walking, going home to their family, that's probably the most rewarding bit.
I think what I like best about the role is about supporting staff and asking them the questions that make them curious about their own services, so that they kind of think, how can things be done better? Are we doing things the best way? Is it the most efficient way? Is it the best way for us? Is it the best way for the patients? And empowering staff to actually say, actually I want to make a change, or I want to test a change. Change is only constant, because things are changing all the time. And for me, it's about having a workforce that are responsive to those changing needs and supporting staff to feel empowered to make those decisions themselves.